Hello, I'm Indiana Senator Todd Young. Heart defects are among the most common and deadliest form of birth defects both in the United States and worldwide. Early detection of congenital heart defects can be life-saving. Thanks to significant strides in screening rates and surgical procedures, an estimated 90% of youth with CHD now survive into adulthood. However, there remains no cure. As adult survivors age, they require lifelong, specialized care, and some patients face ongoing and additional health challenges, including an increased risk of disability and premature death. Gaining a better understanding of congenital heart defects is critical to the nearly 1 in 100 babies born with CHD and the millions of survivors living with this disease. That's why I helped lead the bipartisan Congenital Heart Futures Reauthorization Act to increase research funding and awareness for congenital heart defects. Recently, we were able to pass a funding increase from $4 million to $7 million for this bill. Thank you all for helping increase awareness, support, and education for the countless Hoosier families impacted by this disease. Together, we are conquering CHD.
Hello, everyone. It's U.S. Senator Catherine Cortez Masto of Nevada, and I am happy to join you virtually for the Conquering CHD Advocacy Conference. I want to thank all of the patients, families, advocates, healthcare providers, and policymakers here today for the important work that you do on behalf of people with CHD. You're making such a difference in people's lives, including the 1% of Nevadans who live with CHD. That's over 30,000 people in my home state. You know, when I'm home in Nevada, the top issue for everyone that I speak with is healthcare. That's why I'm so committed to preserving and expanding the Affordable Care Act and other healthcare policies that protect patients and their families, support cutting-edge research, and increase access to quality, affordable health care. I hope everyone has a terrific conference and a safe year ahead, and that includes continuing your care even when you're feeling good. Thank you again for your commitment and your time.
Hello, I'm Senator Susan Collins from the great state of Maine. Thank you for your commitment to conquering congenital heart disease. CHDs are the most common heart problem in pregnant women. These new mothers are at 3 times the risk of also having a child with CHD. 1 out of every 100 babies are born with CHD. Early diagnosis and intervention are critical. I have met CHD thrivers throughout the state of Maine. Their courage and determination in confronting this lifelong condition are inspiring. The collaborative efforts of researchers, medical professionals, patients, and families have strong partners here in Washington. Research is vital to identifying, treating, and perhaps one day curing the 18 distinct forms of CHD. Your advocacy has been instrumental. It led to the passage of the Congenital Heart Futures Reauthorization Act. I also introduced legislation that would incentivize state Medicaid programs to offer whole genome sequencing for children with diseases suspected to have a genetic cause. In addition, we must continue to protect coverage for those with pre-existing conditions like CHD. Your contributions to the efforts of conquering CHD affect the future of millions of Americans living with this disease. Thankfully, due to medical advancements, those with CHD are living longer. Despite these advancements, there is much to learn about how to care for these patients as they reach life's milestones like starting a family. But I know one thing, together we will conquer CHD.
Good morning. I'm Congresswoman Stephanie Murphy, and I proudly represent Florida's 7th Congressional District in Congress. During my time in public service, I've heard from countless Floridians who are facing difficult medical issues or are taking care of loved ones in these situations. Among them are CHD families who are facing serious medical challenges. As you all know, congenital heart disease is the #1 cause of birth defect-related deaths in infancy. It is essential for the federal government to continue to support research to conquer the most common birth defect our children face. I want to thank you for being engaged citizens and sharing your stories. This helps elected leaders like me educate others and spread awareness about CHD and its impact on our community. Congratulations on hosting your annual Advocacy Conference. I look forward to continuing to work with you to educate more Americans about what we can all do to combat this devastating illness. Thank you, and let's beat CHD.
Thanks for inviting me to the 2021 Conquering CHD Advocacy Conference. This year's conference looks a little bit different because of COVID-19, but I still want to send you a message of support. Whether as a patient yourself, a loved one, a health provider, your voice and your story can really make a difference in our efforts to increase funding for research, awareness, and treatment. We all have personal stories and connections to congenital heart defect, and that's what brings us together and shapes our efforts and determination. Together, we've had success past the Congenital Heart Futures Reauthorization Act in 2018, increased funding for CDC's Congenital Heart Program to its highest ever level of $7 million last year, and doing the same for the NIH at $43 billion. This work has translated to better prevention, screening, treatment, and surgeries. We've got to continue to do our part. I want to thank you for channeling your experience into this action. Together, we are conquering CHD.